Hi, everyone. Thank you for your time today. Oh, here you go. Sorry, agenda. So a bit about me. At the start of the pandemic, I started working with both the Ontario and federal government to introduce new respiratory protections for healthcare workers. I noticed there was a gap in knowledge, gap in protections for our frontline workers. And then I started working a little bit with the U.S. government in 2021, 2022 as well. Served on several task forces, including one for President Biden. And now I'm trying to bring in next generation solutions for wildland firefighters, because there are a lot of great solutions out there. A lot of presenters touched upon some of these as well, but they're just not really well known. And so that's a big issue, is just trying to raise awareness to some of these solutions. Sorry. So when it comes to wildfire smoke, particulates is a big factor, is a big danger. And that's where our focus has really been up to now. It's been focused on particulate matter, but really we also have to worry about gases and organic vapors as well. They're irritants, they're carcinogens, and they do cause a lot of issues. And we do have the tools to protect firefighters from these now. So cancer does represent by far the biggest occupational disease among wildland firefighters, but cardiovascular disease, lung disease, and PTSD are really big issues among firefighters as well. And if we start to better protect them, these diseases will start to go down. And it wasn't even until last year that provinces like Ontario actually recognized occupational diseases among wildland firefighters. So understanding that some of these diseases are caused by wildfire smoke and their job is just starting to become known. And that's why it's going to take a little bit of while before we actually learn to get the right tools out there for them as well. So everybody's familiar with an N95. That's what we're really using right now. And where firefighters are still getting exposed to is the fire line, the decontamination process, also investigations as well, because after wildfire smoke has gone through, you have to investigate, you have to move things around. You're going to recreate off-gassing, you're going to be moving particulates, heavy metals, and stuff like that around. So it's not just when there's an active fire you have to be worried about, but also after the fire. That's a big concern as well. And the thing with things like elastomeric respirators and poppers, they could protect you during all these times. So poppers and elastomeric respirators, especially equipped with something called P100 multi-gas and organic vapor filter, something you see a little bit like this. It will help protect not only particulates at a much higher level than an N95, but it'll also protect a broad range of protection against gases and organic vapors, but it's not a one-size-fits-all solution. And it doesn't protect against every gas. So things like CO, you still should be wearing a CO monitor just so you know your exposure levels and maybe when you might need to get to some fresh air. And typically what you often see as well, if you're just looking for particulate protection, you also have like what's called a P100 pancake filter. So sometimes they're pink, sometimes they're white, just a filter that goes on the side. And compared to an N95, it's rated to filter 99.997% of the airborne contaminants. So it's much higher than an N95. And also when it comes to a seal for an N95 compared to an elastomeric respirator, you're getting a much better seal. And you're also getting reduction of things like heat stress, dehydration, especially compared to an N95 without an exhalation valve. And for firefighters that also have to worry about the protection for their eyes, their ocular protection, you can either wear safety glasses, but you can also look at wearing a full face respirator as well. So it will filter out the gases, so your eyes are not exposed to the gases either. And even when it comes, also when it comes to wildfire smoke, there are tools out there that can help you estimate what your exposure levels could be. And you can also use things like air quality monitoring to determine maybe if it's going to be a day where there might be higher concentrations of particulates, gases in the air, and where you might also want to work with higher levels of protection. And this is a chart I created, just kind of helps you understand the difference between an N95 and some of the different filters you can use with an elastomeric respirator, because you have a few different options when it comes to filters. And also when it comes to choosing a respirator, something that's different with a popper than an elastomeric respirator is you don't have to worry as much about the fit testing, the shaving, which can be an issue for firefighters out in the field. And it'll also have air ventilation. So it will help reduce a little bit heat stress because you do have a little bit of fresher air blowing on you as well. But when it comes to poppers, then you also have to worry about a little bit of extra weight, the cost. And sometimes if you're wearing it and there's a hose, then you have to worry about getting the hose stuck with some of the things you're working around as well. So it's not always a one size fits all, and it can be hard to find the right solution. So like I said, they can filter out gases and vapors. They can be safely reused for years as well. With an N95, you're supposed to throw it out after you use it. If you use it for more than a few hours, the seal is not necessarily going to guarantee to protect you. If you're moving your head too quickly, which most firefighters will be, it will break the seal, exposing you to the environment. N95s are also not designed for hot environments like elastomeric respirators are. So that's why you're also going to be getting a little bit more additional heat stress with N95s. And if you don't wear an N95 with an exhalation valve, you also have more CO2 and heat stress buildup as well. So that's another issue that firefighters might face, where you don't have to worry about that with an elastomeric respirator. So some of the common problems I've run into trying to raise the bar for firefighters is our health agencies don't really have the resources and knowledge needed to be able to keep up with best practice. The US government is a great example. They have quite a great wealth of resources, a lot of teams. They're, I'd say, at least 5 to 10 years advanced, more advanced than Canada is when it comes to wildfire smoke protections. But in respiratory protections in general, I would say it's probably a couple decades. But we're catching up now thanks to things like the new CSA standards that are about to be released, and thanks to organizations like ASTM. It's going to start being more on par around the world. So we're not going to have as many differences in between jurisdiction, where in maybe one province you wear no respiratory protection, where in others you're wearing a PAPR. So it's going to be nice to have a little bit of new regulations to go with as well. And our government also operates at a snail's pace. Like when I was working with an opposition leader, we'd send questions to the minister, and it would take about 4 months to get an answer. And it would just be one paragraph, simple answer. The answer would often be not even to questions we asked. And also a big thing is focusing on what's familiar. Not everybody's familiar with an elastomeric half-face respirator. Most people are familiar with an N95s, and that's why you often will see Health Canada, everyone focused on N95, but we forget there are other options out there. So in 2022, that's when I first noticed that Canada was pretty far behind on wildfire smoke. One of the task forces I sat on, POM 23, we were looking for next generation solutions for public health emergencies, for pandemics and biological threats. And we focused on elastomeric respirators for the healthcare settings, but we also partially discussed for wildfire smoke as well. Because back in 2022, that was when the US government first realized for wildland firefighters, we really have to ditch our N95s, and it's not really well protecting us. That's when they started coming out with resources by the Department of Homeland Security. And there's some great resources out there that show 20 different options among many different manufacturers, and explains why we need to be using multi-gas filters and getting rid of the disposable options. Back in 2023, that's when I first started realizing Canada, we lacked the knowledge and collaboration within our agencies. We had the worst wildfire season to date we had at that time. And everybody was saying we couldn't protect against gases. The only thing available was an N95. We didn't have reusable options, and we couldn't really protect against gases found in wildfire smoke. But as a lot of presenters showed today, we do have a lot of protections against gases. And in 2023, I also worked with an opposition leader because our provinces and federal government do have stockpiles of elastomeric respirators that they purchased during the pandemic. So we could be using resources our government and taxpayers already paid for and just repurposing them for the wildland firefighting community instead of the communities that worried about infection prevention. But at that time, the government didn't know very much, so they decided to pass. And then in 2024, we saw with Jasper what a really big disaster it can be on a moment's notice. So what happened with Jasper is a lot of firefighters and first responders had to be pulled from the community because they didn't have the right respiratory protections. Only the firefighters with their SCBAs were allowed to stay. And because of that, a lot of the community burned, and we weren't able to protect as much infrastructure as we could have. Had the respirators been available for firefighters, first responders, people evacuating the communities, then they could have evacuated more safely. We could have had more personnel safely stay behind and help support whether it's protecting the infrastructure, providing first aid, providing medical treatment, providing communications assistance, or anything else. It would have been much easier to do. And also, that's when I started working with an opposition leader again to try and get the minister to introduce these policies at the federal level. But we received a letter in November saying the federal government could not collect enough information. We couldn't let the firefighting community know. We won't let the public know because we assume they don't have access to fit testing. So there's quite a few different issues that happen, and we really dropped the ball. And also at the Ontario level, I started speaking to Ontario politicians as well, an M&R official. And the M&R official that I spoke with let me know Ontario was going to eventually upgrade protections for wildland firefighters from a cloth mask to something better, but they couldn't let me know what that better is. They couldn't confirm that they would even let them know about elastomeric respirators in the future. And it was only something they would eventually let wildland firefighters know, but not even directly. It would end up being through their bargaining unit. So, and then this year, the opposition leader, again, helped me behind the scenes. We're trying again to get the federal government to update their policies to remove misinformation, like we can't protect from gases found in wildfire smoke. Because if we don't know that these options exist, we're not building on that foundation. We're just building on the options we know what's available. Also, somebody at the Public Health Agency, a vice president of the Public Health Agency of Canada, did let me know they're going to start letting the public, firefighting community, and others know there are many limitations that come with N95s. For example, moving your head too quickly, that you have to dispose of it. But those recommendations have still yet to come up. Okay, so I'll just skip a couple of these. So this same issues happened when it came to infection prevention. The government didn't know what elastomeric respirators were for infection prevention. The CDC had been recommending them for decades. The CDC spent millions on studies on the need to put them into widespread use. We just didn't really know about them in Canada, so the government purchased it, officially put it into policies, but didn't even let the frontline workers know about those policies and often actively prevented them from using it. Started working in 2021 also with journalists, politicians who were trying to work at the internal level to have it fixed. But still, there's not enough known at that time to update anything. I worked with the New York Times on a major investigation because even the US government, they didn't necessarily communicate properly to the public or the frontline community know about elastomeric respirators. And the New York Times investigation I worked with found that up to 3,500 healthcare workers died in the US because we failed to use these advanced options for infection prevention either. And then in 2023, there was a working group in Washington, D.C., where I worked alongside directors of NPPTL. There was top officials from the Department of Defense, CDC, and we came out with the next generation solutions. And that's actually to get rid of N95s in healthcare settings and move exclusively to elastomeric respirators. And that's how important they are for infection prevention. But particulates from wildfire smoke, they get filtered the same way a virus would. So imagine these technologies, even if you're not worried about the gases, you could still upgrade the protections against particulate matter as well. In 2024, we released our paper, and within a month, the Department of Defense in the US decided that they're going to be looking to purchase 3 to 5 million for the Department of Defense because it was very essential for military readiness and also for any future biological or biological threat as well. And then even this year, we almost lost NIOSH, one of the world's most important agencies. So I worked behind the scenes to try and get different groups, including unions, to work together, industry to work together. And we were able to save NIOSH, but there's still an uphill battle when it comes to saving agencies like NIOSH. So the key takeaways, when it comes to respiratory protection for wildland firefighters, we have to work as a group. That's why things like this educational symposium, ASTM, CSA, they're great groups to collaborate. And that's why when we get groups like this together, we learn about a lot of things we might have originally overlooked or might not well have understand. And we should also look at things like voluntary use of higher levels of respiratory protection, because we saw during the pandemic with wildfire, we say something is good enough, so we don't let firefighters and others use higher levels. But if we start letting them use higher levels at the voluntary level, then we're playing with a better safe than sorry, and then we don't have to see in 5 or 10 years all these high rates of cancers, heart disease that we're going to see, especially as the wildfire seasons grow in intensity and frequency. And we can also use what the government already has. We already have stockpiles of these respirators. So sometimes it's just distributing what we have. And then if we have time for questions.
If we could thank the speaker. Unfortunately, we do not have enough time for time, but we want to, time for questions, but we want to thank you for your enthusiasm. If anyone wants to talk to me, clearly has a lot of things to both show you for those that are in the room and talk to you about. So thank you very much.
Oh, and I also forgot to mention, not every elastomeric respirator is the same. So some people might choose something that's more built for communication, more built for breathing resistance, more built for high heat environments, more built for universal size, so we don't have to worry as much about fit testing as well.